Hello, I'm Gary. Welcome back to FYPC. It's my channel about my prostate cancer experience, sharing stories and insights for the benefit of others who might be going through this journey. Today we're going to talk about prostate cancer. What is it? What kind of symptoms you might get? What kind of risk there is? And what you should do about it. So let's crack on with the definition. Prostate cancer is when the cells in the prostate grow uncontrollably, like many other cancers. This is cells out of control. Interestingly, 1 in 8 men in the UK are going to get prostate cancer in their lifetime. Now the good news is that if it's caught early, and it's still inside the prostate, it might not cause too many problems, but when it starts to get outside the prostate and spread to other parts of the body, that is when we need to take urgent action to stop or delay the spread of the cancer. So let's think about the symptoms. The first thing I want to say to you is that in my prostate cancer journey, I didn't have any symptoms. So I went to the doctor for a routine health check, and he said, look, you're over 50. I see we haven't done this test for a while. We're going to do the blood test that looks for prostate cancer, and just add that to the normal range of blood tests. And I'll tell you what happened about the results from that. But that's the important thing to think about, is that there aren't really necessarily any symptoms to this. However, think about where the prostate is. It's underneath the bladder. It surrounds the tube, the urethra that takes urine from the bladder out of the body. So one of the symptoms that you might see is difficulty in urinating. Any kind of change in your urination habits, be on the lookout for that. If the cancer has spread to other parts of the body, well then you might start to get some back pain, you might get some hip pain, you might get some pelvis pain. You might have difficulty getting or keeping an erection, so watch out for changes in that area. And you might even see blood in your urine or in your semen. And if that happens, then really what we're talking about is use that as the trigger to go immediately to your GP and have the tests, get them to assess the situation. Now, thinking about risk, right? According to Prostate Cancer UK, there are some areas where there is greater risk. So if you're over 50, you may be at higher risk of getting prostate cancer. It is a disease that mainly affects men over 50. If your father or your brother had prostate cancer, then that also increases the chances that you could get it. And interestingly, if you're a black man, in the black community, the occurrence of prostate cancer is 1 in 4. 1 in 4 black men will get prostate cancer. So again, it indicates an elevated risk. And also, if you're overweight, it seems likely that you will get prostate cancer that is more aggressive and may already have spread. So again, you're at increased risk by being overweight. So what are we going to do? We know what prostate cancer is, we know what kind of symptoms we might expect, we know which parts of society are at higher risk. Any of those things that happens, any of those symptoms that occur, any of those triggers, like your father or brother having prostate cancer, why not go to the doctor, ask their advice, work out whether it's good for you to have a test right now, and go and have that blood test. And I'll tell you all about my journey from that initial blood test in other videos on the channel. So thanks for watching. Do subscribe, click the bell, keep watching, because there's something coming out every week, and I want to spread these stories so that people really understand what prostate cancer is. I'll see you soon.